Good morning, everyone. This is Todd Brow with Senior Insurance Marketing, and we are excited to have Tamara Kuntz with us with United Healthcare to talk about the dual SNP market. It's a huge market, and to me, it's an untapped market that has huge opportunities and potential to help folks out with their healthcare needs. So without further ado, I'm going to swing it over to Tamara, and Tamara, take it away.
Awesome. Thank you, Todd. So thanks, guys, for joining today. I'm just going to take some time to talk about some of the opportunity with our dual special needs plan and talk a little bit about the opportunity with United Healthcare and just some of the opportunity that we have across the country with our product as we continue to grow and expand. So go ahead, next slide. So just a quick overview of the agenda. We're going to go, I'm going to take some time to talk about just the national overview, some of the opportunity that we have, just do a little intro into what is the dual special needs plan, who is a dual eligible, talk a little bit about United Healthcare as a company, go into some market benefit details. Won't take too much time on that because I realize we have some people off on the call from different states, but I'll just talk a little bit about some of the benefits and where you can find your state-specific benefit for your market as well. I'll highlight real quickly on compliance. I promise not to bore you guys with too much compliance stuff, but we did have some changes for 2019 that I wanted to cover real quick today. And then talk a little bit about the marketing opportunity that you have available to you being contracted with United Healthcare. And finally, just wrap up with some initiatives that we're doing as a company to help with retention and the member experience. Next slide. All right. So just a quick intro into the dual special needs plan. The D-SNP audience is those that have both Medicare and qualifying Medicaid status, which makes them dual eligible. These individuals, which we have over 10 million nationwide, have the ability to get more benefits without paying any more by enrolling into a dual special needs plan. The D-SNP is a type of Medicare Advantage plan. The D-SNP members, they can benefit by getting coordinated care to maximize their benefits, as well as extra benefits beyond Medicaid like vision, dental, catalog or debit card credits for health products depending on the plan. And another kind of fun fact, of the 10 million dual eligibles nationwide, almost half of them live in a United Healthcare coverage area, which I'll talk about here on the next slide. So this map here really shows our expansion for 2019. So all the states that are highlighted in green are where we had some sort of expansion. And that's not to say that it was new to the market, like Nebraska and Iowa. We had a presence with the dual special needs plan in 2018. We just expanded into more counties for 2019. So this really just shows where United Healthcare has a footprint with the dual product. So you can see that we do have a lot of states currently that we have the dual special needs plan product in. We are currently, we're always expanding. I would expect to see some more expansion for 2020. So if you're on the call and maybe you live in one of the states that are gray, I would highly recommend hanging on, listening to what we have to say, because we really, there's a really good chance we could have more to talk about here with 2020. So it's a very growing market. We're working a lot to get some product out to everyone that we can. We're focusing on the highly populated dual population areas. So definitely a lot of opportunity across the country. Next slide. All right. So this chart shows our growth from 2011 through now. This growth is really a result not only of our expansion, but also our commitment to our product and our members. Year over year, we continue to add more benefits to our products, and we continue to find more ways to help our members better manage their care. So for 2018, we brought in over 100,000 more sales than last year, and we'll end up with over 3 times more sales than we had in 2015. This type of year-over-year growth is exceptional, but what we're really excited about is our net growth as a result of our retention process as well. So people are really staying on the plan. They're not just signing up and leaving us, which is helping with our growth numbers, and is showing a lot of success year over year. So I just mentioned that we're building a D-SNP business, and this is what I mean by building the business. So United Healthcare is currently owns 33% of the dual special needs plan market. That means 1 in every 3 D-SNP members is covered by United Healthcare. We're growing over 3 times faster than our closest competitor, and we continue to build our overall membership base. So there's a lot of D-SNP players in the industry. Actually, there's over 90, but with the competition getting tougher every day, but United Healthcare has really been here from the beginning, and we've established processes and support to make sure that our members are getting the product that they need. So year over year, we're delivering on expansion. We're making sure that we have exceptional benefits, and we're really making sure that we have the consistency that you need to grow your business. All right, next slide. So that's kind of an overview on the just kind of national overview on the Dual Special Needs Plan and some of the opportunity that there is across the country. I just want to take a few minutes and talk about some of the opportunity in Nebraska. I'm going to go over our product here in Nebraska, but I'm also going to show you, in case you're not in Nebraska, how you can find information on the product in your market. And then also I'm just going to do a little shout out here. If you want more information on any information for your individual market, please reach out to Senior Insurance Marketing. They're going to be a great resource. They can help get all of the plan-specific information that you guys will need to make sure that you have all the information on your individual product. So go ahead, next slide. So this map, this is our service area map for Nebraska, and we can get you this map for any other state. So if you are interested in seeing this map for Iowa or any of the other states that we have the product in, we can definitely get that to you. But this is the Nebraska map, and this also shows our expansion here for 2019. So you can see we had a footprint of about 4 counties here in 2018, and in 2019 we added 12 more counties. And those 12 counties are just in Nebraska. We actually also added Potawatomi and Mills over in Council Bluffs. So we really, in the Nebraska market, we consider Council Bluffs to be part of our Nebraska market. We added 14 new counties here for 2018. So when I talk about our rapid expansion, that's what I mean by it. Up in Iowa, we added a ton of counties up in Iowa as well for our expansion. Go ahead, next slide. So here's kind of a quick glance on the product, and I'm not going to go through every line-by-line benefit, but I'm just going to highlight a few. So the dental benefit is a really big one for the Nebraska plan, and the dental benefit we have for our plan is actually $1,500 in comprehensive and preventative dental services. And one thing that's great about the Dual Special Needs Plan that a lot of people don't understand when they first get into working with the D-SNP market is that all of these benefits are in addition to the Medicaid benefit. So the Medicaid dental benefit for Nebraska is $750. So the $1,500 that they get in dental benefit with the dual plan is in addition to the $750 that they get with their state Medicaid benefit. We also have a lot of other benefits. We have chiropractor and acupuncture. We have foot care benefits, hearing. Another big one that we have that I mentioned earlier is the over-the-counter catalog benefit. So we partner with First Line Medical, and we have $140 a quarter or $560 a year in credits that our members can use to purchase over-the-counter products. So this is items like bandages, vitamins, just a variety of things that you might get at a local Walgreens store. And the Nebraska plan actually, the $140 a quarter that they actually get a debit card mailed to them, and they can take that debit card to their local Walgreens, and they can get items that are approved at the local Walgreens store. So depending on your market, that benefit might vary a little bit. The debit card is not in every market, but most markets are going to have some sort of over-the-counter catalog benefit, whether they're placing an order in the catalog or using the debit card to get that benefit as well. So there's a way that most markets will have that benefit available to them. We also have the Personal Emergency Response System available in Nebraska. So that's the button. They can get a system set up in their house, and if they fall or have an accident, they can press a button to get some help and assistance in case of an emergency. So it's kind of a highlight of our benefits for the dual plan in the Nebraska market. Go ahead, next slide. So in case you don't work in Nebraska primarily, maybe you focus in a different market, I just wanted to show you real quick how you have access to pulling up the benefit details in your market. So through the United Healthcare Jarvis site, so uhcjarvis.com, you can log in and access the plan search. So through sales and marketing tools, you can go down to plan search. When you're there, you can type in your zip code, and it'll show the plans that are available at that zip code. So I went ahead and typed in a zip code in Lincoln and pulled up all the plans that are available by United Healthcare in Lincoln for that specific county. So you're able to do this for any zip code across the country. So if you want to see, maybe you're not even licensed in Kansas, but you want to see what the plans are in Kansas and if it's worth getting licensed over there, you can go onto Jarvis and type in that zip code and see the plans available. Then you can also hit View Plans and you can see all the details of it and just kind of see what some of the line-by-line benefits are. Another really great resource that you can use to compare plans available in a certain market is going to be through Medicare.gov. That's just another great spot where you can view all carriers, not just United Healthcare. Go ahead, next slide. So next, I just want to take a couple minutes and talk about compliance updates. I know it's not everyone's favorite conversation usually, and I'm not going to spend too much time on it, but there were a few changes here for 2018 that I did want to just take a little bit of time to go over. So go ahead, next slide. So we added a new enrollment period for 2018, which I'm sure some of you guys are familiar with, but we added the Medicare Advantage Open Enrollment Period, OEP. So as you guys know, consumers need to have a valid election period in order to enroll or disenroll from a Medicare Advantage or prescription drug plan. So we have the annual election period, and then we have the open enrollment period, which is new, which is January 1st through March 31st, where they can actually disenroll from a Medicare Advantage plan and go into a different Medicare Advantage plan or go into original Medicare. We also have the initial enrollment period, so when they first get their Medicare, they're able to use that initial enrollment period to pick a plan. And then special election period, this is what someone would use for the dual special needs plan, is that special election period. There's a huge list of special election periods. So, if someone moves into a new plan service area, they would have an SEP. But if someone is full Medicaid or even partial Medicaid, or even if they don't have Medicaid but they have low-income subsidy, those are all a special election period that they could use to enroll into a new plan. So they don't have to wait during AEP. That's what provides a really good opportunity right now to work with the dual eligible market, because they have an election period where they can sign up for the plan right now. So definitely a good opportunity. You can work it year-round. We have a lot of people that like to work with the dual eligible market, during SEP, and then during AEP they switch their focus back to HMO, Medicare Advantage. Maybe they do some more Med Sup business. So definitely there's opportunity to work the market a little bit more during the special election period. Go ahead, next slide. So this slide here goes into some more detail. I kind of already talked about this, but like I said, that Medicare Advantage open enrollment period, that is new for 2019, so people can switch off of a Medicare Advantage plan and go back to original Medicare, or they can go from one Medicare Advantage plan to another Medicare Advantage plan using the election period OEP. They can only use OEP once, so they can't use OEP and keep switching from plan to plan, but they can use that once between January 1st and March 31st. Next slide. Perfect. So the change that we have for specifically for the dual market is, like I mentioned, they can use that SEP. It's actually called dual LAS maintaining. That special election period is going to allow someone to sign up for a dual special needs plan during SEP. And the change that we have for 2019 with the dual eligible market is, instead of being able to change every month, they can now change once a quarter. And this is across across the whole board with any carrier, with any product. They can only use that dual LAS maintaining special election period once a quarter. So that was CMS regulated, and so you can kind of just think about it, January to March, that's one quarter, and then they can make one change to sign up for a dual special needs plan, but they wouldn't be able to sign up for another one in that same quarter. And then that last quarter, the fourth one, is they're going to have to use AEP and sign up for a January 1st effective. So that's new for 2018 as well. And if you're confused by this, if anything doesn't make sense, please feel free to reach out to Senior Insurance Marketing. You can also reach out to the Producer Help Desk. They're a really great resource. It's the United Healthcare Agent Support Line, and they can help let you know if you're meeting with a client or a member. They can let you know if the person would be qualifying for that SEP, if they've already used their SEP. They can let you know if they qualify for the dual plan. So that PhD is a really great resource as well. All right, so some marketing updates. This is my last slide on compliance. I just wanted to talk through a couple changes, other changes that we had for 2018. Provider marketing opportunities. So you can now have market and have a presence in patient waiting areas. That's a new change for 2018. I already talked about OEP, so you can change someone from a Medicare Advantage plan to a different plan during OEP. Just a side note on that. You're not allowed to market during OEP, or you're not allowed to market OEP, but you can market yourself during OEP, but you can't tell members about OEP while you're doing marketing. And then educational events, they've always been pretty strict in the past. And then for 2019, they've kind of eased up on some of the educational rules. So you can display and accept business reply cards now. During an educational event, you can hand out business cards, and you can even schedule in-home or follow-up appointments with a scope of appointment form during educational events now. All right, next slide. All right, so some resources and support that's available for you. So now we've talked about the product, a little bit about the audience, and talked a little bit about some compliance and opportunity that you have with the election periods. I just want to talk quickly on some of the opportunity that there is with marketing and support. So go ahead, next slide. So I showed you guys how to access Jarvis before, uhcjarvis.com, and I was kind of showing you the plan search. Another thing that's really great that you have available on Jarvis is going to be the Toolkit. The Toolkit is going to have all of our marketing materials that are all CMS approved. And what's great about the Toolkit is you have a lot of really great resources that are available for you at no cost. So you can create flyers, like benefit or meeting flyers. You can create brochures. All this stuff that I have on the screen here is customizable, so you can put your name, your phone number. A lot of the stuff you can even put your agent photo if you have a headshot that you can include. You can order birthday cards. You can even get like business card magnets, and a lot of this stuff is at no cost to you. So if you wanted to get into the dual market and you want to do some initiatives and maybe hold some meetings, there's a lot of really great resources that can help you market. That'll really make you more successful with your meetings and your outreach. Next slide. So what's great about the Toolkit, I mean, it's all marketing related, and it can really help you sell more. One of the things that's kind of cool on the back end with the Toolkit, it's United Healthcare program we have access to, and we can see what agents use the Toolkit and how much they sell. So we're able to compare Toolkit users to non-Toolkit users. And not very surprising, but non-Toolkit users do on average about 5.5 applications, where Toolkit users do on average 39.75 applications. So not very surprising, because the Toolkit users are doing more marketing-related initiatives to help support their events. And another thing is they're not wasting time trying to create their own pieces. All the pieces that are available on the Toolkit are available for you. Like I said, you can customize them, put your name on them, and then they're all CMS approved already. So Toolkit users have 8 times more sales than non-Toolkit users, which is kind of a cool fact. All right. So taking care of our members. So when you guys go out and you put in the effort and you do the business in the dual market, there's kind of some interesting things that we have on the back end. We have a whole retention team that's going to work on making sure that they retain the members. And it's also kind of interesting. It's a little bit different demographics than just the typical Medicare market, which I'll talk about here on the next slide. So we've actually done some research as a company, and we've broken down our dual eligible consumers into two different groups. So we have our dual eligibles that are 65 and older that are on Medicaid, and then we have our dual eligible plan that are under 65 and disabled, and they're on Medicaid. So we have kind of these two different categories on people that we market towards, and it's just kind of an interesting statistic is the people that are under 65, we actually make up about 45% of our dual population. So, if you sell a lot of Medicare and you do a lot of Medicare initiatives, it's kind of a shift in mind when you look to do marketing towards the dual population, because you're now focusing more on kind of a split between just 65 plus and then people under 65 that might be on disability. So definitely kind of a different way of thinking when you're looking to get into this market. And on top of that, a really great way to get sales in the dual market is to really find where the people, where the eligibles are, and really try to get in front of them with events. We find that those agents have the most success when they're able to get out in the community, work events like maybe at a food bank, or try to get in front of people that way, have a lot of success with this market. So United Healthcare really believes that our members and our agents are both at the center of our success. So in addition to our assortment of ancillary benefits, our members really receive a lot of coordinated care when they're on the dual plan. And coordinated care is really at the heart of all of our plans, but especially when it comes to helping our members live a healthier life. Our members' quality of care paired with our ability to educate them on benefits and services available to them has really created a lasting member experience. So one initiative that we do is new member onboarding calls. So this really reinforces the enrollment process. So when we have a new member that enrolls on our dual plan, we make sure to give them a new call, introduce them to the plan, talk a little bit about the benefits, make sure that they know what providers they're able to see within our network. We can even schedule in-home care visits with them through that call. And the calls really on average only last about, calls average over 15 minutes. So they do get a lot of time just kind of getting all the information that they need to about their plan. Another nice thing about these welcome calls is that they are made in several different languages. So when you're doing that application, you're enrolling someone on the dual plan, just to make sure that you're putting down the language that they primarily speak on there, so that they can get someone to outreach to them in the language that they're most comfortable in. So member retention, completed onboarding calls, so these outreach calls that I was just talking about, they reduce rapid disenrollments by 50%. So we also have a really high average retention rate, 4.8 years. And like I said, that the new calls, those onboarding calls, they have a 2 to 4% disenrollment rate if they receive that call, and a 4 to 8% disenrollment rate if they don't answer the call. So finally, if this is a market that you're looking to get into and you want to start working with the dual population and you're doing some apps, we really ask that you help us with these welcome calls. Make sure to let them know that they're going to be getting one. Make sure you put a phone number down that's relevant to the application. Make sure you put a phone number down. If you can get an email address, anything that we can use to contact the member, really just helps our retention team make sure that we can keep them on our list, keep in communication with them, and really just help service them to the best of our ability. Another thing too, if you're looking to get into the dual market a little bit and you haven't worked with it a lot in the past and you have any questions, please reach out to Senior Insurance Marketing. They're a great resource. They'll help make sure you're comfortable with the product. They'll help make sure that if you have any ideas on some sales strategies that they can help you really execute those as well. And I'm really here as a resource as well. I work directly with United Healthcare. Again, my name is Tamara, and I'd be more than happy to help you with any initiatives as well. But there really is a ton of opportunity in this market, and we ask that, really, if it's anything that you're interested in, please reach out. We'd love to get you rolling with working with this population and selling some apps. And that's all I have. Does anyone have any questions?
if anyone has any questions, feel free to put it in the Q&A box because I have everyone muted just so we have a good sound quality here. So I don't see any questions right now, Tamara, but I encourage everyone to give us a call here at Senior Insurance Marketing at 877-800-3080. Again, 877-800-3080. We would be happy to help you out with this exciting market here, the dual SNP, and it's a market here that is really hasn't really been tapped into that much. So there's a lot of potential and opportunity for you. So feel free to give us a call, 877-800-3080, and we'll be happy to help you out with any questions you have about this product as well as any other product. So we're here to help you grow your business. Take care, everyone, and have a great day.